It's really open to anyone to join.
Sorry,
And
sorry, Katie.
that's okay. I was going to say about the recording in a moment, and I'll share a link in the chat for anyone who wishes to join the network. And as you've just heard, we'll also be recording today's webinar. So if you do not wish to be seen, then please do turn your camera off. We'll be sharing this on our YouTube channel after today's session. But today we're really excited to have guests from the SHAPER study to share results from their research. So SHAPER stands for Scaling Up Health Arts Programmes Implementation and Effectiveness Research. It's led by King's College London and University College London. The broader research programme explores scaling 3 effective arts programmes, but today we're just focusing on one of these, Melodies for Mums, which you're going to be learning about shortly. Regarding the structure of the event, we're going to have 3 short presentations and a short singing session, which should take us to around 3:45 p.m. And then there'll be an opportunity for you to ask questions if you have them at the end. So we'll only be taking questions in this last section of the webinar. And if you have anything as you are going along, feel free to pop those in the chat. And if people have time to answer them whilst they're in between presentations, they will. Otherwise, we'll address as many as we can at the end of today's session. But without further ado, I'm really delighted to introduce our first speaker, Lorna Greenwood. So Lorna is Head of Scalability for Breathe Arts Health Research, including managing all the different strands of their Melodies for Mums programme. And she's the person who's been leading their partnership with the SHAPER study team. And she'll also be handing over to Cleo Lane after her presentation. Cleo is the choir director of Breathe Arts Health Research and has worked for Breathe for many years, both as singing lead for Breathe Melodies for Mums and for Breathe Sing for Lung Health. So thank you very much, Lorna. Over to you.
Oh, that's great. Thank you so much, Katie, for that really lovely introduction. And you covered what I was planning to cover at the start, which is that really overlong acronym, SHAPER. So thank you for doing that for me. I'm really delighted to be here today to share our findings with you from the SHAPER research study with my colleagues, Professor Carmine Pariante and Dr. Alexandra Burton, and of course my colleague Cleo, who's a fantastic singing lead for us at Breathe Arts Health Research. It's particularly nice to be presenting to our colleagues and friends in Scotland and Arts, Culture, Health and Wellbeing Scotland, because we actually were in Scotland last year for Healing Arts Scotland in Edinburgh, where we shared some very, very preliminary findings. So it's great to be here today to update you on that. And I hope you've got your vocal cords warmed up, because we're going to have you participating in a little virtual taster session soon too. So that will be after I've done my slides. So I'm just going to share those now. And hopefully you can all see them. Anyone that's got their camera on, can you just give me a thumbs up? Fantastic. Okay. So we've covered what the SHAPER study is and what we were looking at. And as Katie said, we'll be looking at our study specifically today, which is SHAPER PND. So focused on the programme Breathe Melodies for Mums. And these are my details. This is a picture of me with some mums in our groups. So as Katie said, I'm Head of Scalability at Breathe Arts Health Research. We're an award-winning not-for-profit social enterprise. We're based in London, and we have over a decade's experience of delivering evidence-based programmes across a whole range of art forms, and they're all designed to meet specific health and wellbeing needs. And the urgent need for this programme, Breathe Melodies for Mums, addresses is maternal mental health. And 1 in 10 new mothers experience postnatal depression in the UK. And suicide is the leading cause of maternal deaths in the first year after birth, which accounts for 39% of all maternal deaths in this period. Early intervention with postnatal depression is absolutely key. And our programme is designed to break down many and complex barriers new mothers face in accessing mental health support. It's based on research by the Royal College of Music and Imperial College London that showed that weekly group singing could improve moderate to severe symptoms of postnatal depression faster than creative play or care as normal. And what makes Breathe Melodies for Mums unique is that the sessions are designed with the mother's creative identity at the heart, building confidence and connection with their baby and other parents through singing. And the sessions are very much a nursery rhyme-free zone. Specialist singing leads use an international repertoire of simple songs in a range of different languages, challenging the group artistically through the teaching of rounds and harmonies across a 10-week period, whilst providing tools to soothe and connect their baby through song. And there's no pressure to talk about feelings in this group. The focus is on the singing, and you'll hear more on the research supporting the benefits of this shortly from my colleagues Carmine and Alex. So since translating this research into practice back in 2017, Breathe have reached well over 1,000 new mothers and babies through delivery of this programme in various settings. So firstly, we work in the community. We're working in 5 different boroughs of London, and we've recently been commissioned by 2 local authorities as part of their Start for Life provision, including in Southwark, where they're also supporting us to pilot a new programme for dads. And that's really quite exciting because we were commissioned in those Start for Life provisions as an evidence-based intervention, not just an arts and health intervention. So we were commissioned on the basis of the evidence that shows the impact this programme has on maternal mental health. We also work in hospitals, and we've delivered this programme in 2 mother and baby units in London, reaching inpatients experiencing severe mental illness, including postpartum psychosis. The programme obviously had to be adapted to that setting, and we've just completed a service evaluation in partnership with our colleagues at King's on this work. We're still delivering the programme online beyond the pandemic, when we kind of originally adapted it to that setting, because there continues to be demand for it, perhaps due to some of the symptoms that new mothers might be experiencing, such as feeling isolated or finding it difficult to leave the house. But also, I think we can really reach people who are kind of located in different kind of geographies that maybe it's harder to access programs in person, so in rural communities. And we've also found as well that we've reached quite a few people who have kind of toddlers or kind of second children and finding it hard to kind of access groups just for them and their baby. So actually it works quite well for them. And finally, internationally. So it's just fantastic to be with Katie today, because we collaborated on a project with WHO, which was their Music and Motherhood project. And we partnered on that as a training partner, and we trained teams in Denmark, Italy and Romania to deliver a version of this programme within the cultural context they know best. And this year, actually, there's been continued interest in that internationally, and there's a real community of practice growing. And this year we've worked with teams in Switzerland, Ireland and Portugal to train them too. So it's very exciting how this programme is reaching more and more mothers internationally. I just wanted to share a few images here, just really to recognise the incredible participants who've engaged and taken part in the research that we conducted, and in our groups generally, because without their commitment to the research, none of it really would have been possible. And it was quite a big commitment. Many of them have gone on to become ambassadors for the programme, and we're looking forward to sharing the results of the study with them once published later this year. I think another point that's quite interesting with regards to these participants is some of the feedback we had from them on their motivation for engaging with research was that they really wanted to kind of give back to other kind of future mums who might be experiencing similar things to them, really wanted to kind of, there's a legacy in this work and hopefully opening something like Breathe Melodies for Mums up to more mothers in the future, which I found really touching actually, and quite interesting. It surprised me, that feedback. And finally, a couple of points of reflection. I think the biggest challenge during this study for us was definitely the recruitment of participants. There are already lots of barriers that new mothers are facing in accessing support, and I mentioned that earlier, and we started delivery of this research study at the tail end of COVID, when restrictions were making it even harder to access things. But through close collaboration with the research team, we built a real diverse range of recruitment methods that we're still using beyond the research today. And we're now regularly recruiting groups of up to sort of 15 women across our sessions in South London. And I think the biggest success in terms of the research study for us was the teamwork. So we built real close connections with our fellow arts organisations, Rosetta Life and EMB, and of course our research colleagues at King's and UCL. We collaborated so closely with them to support each other, to overcome challenges and build really strong partnerships and actually systems that will really last beyond the study. So before I pass over to Carmine and Alex to share the findings of our study, we actually thought the best way for you to experience and understand Breathe Melodies for Mums would be to take part in a little taster with one of our fantastic music leads Cleo Lane. So I'll pass over to you now, Cleo, and I'm going to stop sharing my slides so we can see each other's faces.
Thanks, Lorna. Hello, everybody. Welcome. That was so interesting. I love to hear about Melodies. I've been working with Melodies for a long time, and I had postnatal depression after both my children. That's what they used to call it. And so it's amazing for me to sort of now be an older, have older children and come in and work with mums going through this big identity shift. So we're online. Sometimes if you want to stand up, you can. I'm going to stay sitting down. We're going to have a big stretch and make a noise. Oh. And have a yawn. Oh. Lovely. And then just leaning over, opening up our rib cages on one side. And then the other. And then come back to center. And we're just going to roll our shoulders backwards. It might be more comfortable for some of you to roll them individually, but I'm just going to go with both. Backwards and then forwards. And then bring them all the way up to your ears as high as they'll go. And then release them on a sigh. And halfway up. And release. And quarter of the way up. And let them go. Fantastic. And then quite nice one that we like to do is have a bit of a moan. So if you've got any glasses, take them off and then bring your hands down over your face. Have a moan. And obviously if you've got mums with their babies, we do a lot of these exercises one side at a time because we're holding babies, things like that. So that's just a little warm up. So I always make sure that we're feeling warmed up and ready to sing. We're just going to do a little breathing exercise now before we learn a song. So just imagine you've got an invisible thread lifting you up through the top of your head, and you're sitting up in your chair or standing up if you're standing up with feet hip distance apart. Bring your shoulders back and down. So you've just got that invisible thread lifting you up. You might be able to feel your tummy muscles engaging now when you do that. Inhaling through our noses now, keeping our shoulders nice and low. Inhale. Inhale. And relax. Great. So you should be starting to feel a bit more relaxed. Just nod our heads slowly, just releasing any tension in our necks. And a slow shake from side to side. Great. So bringing those shoulders, making them nice and low. And then we're going to do a little bit of a warm-up. So just sing whatever you hear. This is silly, okay? We like to have a lot of fun in these exercises. So just sing what you hear. I'm going to go up and down our voices a little bit just to make some sounds and just get used to feeling what that's like. So here we go. Do 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 do. Shooby dooby doo wah. Ma 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 ma. Na 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 na. Goo 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 goo. Goo 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 goo. Goo 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 goo. Woo woo. Hidey 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 hi. Hody 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 ho. Nya 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 nya. Nya 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 nya. Va 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 voo. Shoop shooby doo woo. Ba 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 ba. Pa 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 pa. Cha 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 cha. Shooby doo wop. Pa 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 pa. Shh 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 shh. And we quite often do jazz hands at the end of that if we're doing an online session. And we do lots of coming on and off mute if we're in an online session too. Right, so I'm going to teach you a song now. This is how I would teach it if I was online, but also in person. It's called Belle Mama. It's from South Africa. It's in Zulu. And the words mean call mother. I'm going to see if I can just pop the words up in chat. There we go. So I've just popped them in chat for everyone, but you might not need them because it's quite simple. So the words are Bella Mama. Just say that. Bella Mama. Bella Mama. Bella Mama. Yay at the end. So that's it. And it goes like this. So I'm going to sing it once and you listen, and then I'll sing it again, and the second time sing along with me, and that's how you're going to learn the song. Okay, so here we go. Bella Mama, yeah. Try it with me. Bella Mama, yeah. Bella Mama, yeah. Sing it with me. Bella Mama, yeah. And then Bella Mama, Bella Mama, Bella Mama, Bella Mama. Let's go. Bella Mama, Bella Mama, Bella Mama, Bella Mama. Last one. Bella Mama, yeah. With me. Bella Mama, yeah. So let's go from the beginning and sing it all the way through. The first and the last phrases are exactly the same. So you've just got two different ones in the middle. Make sure you're sitting up as straight as you can so that you're not slouching and putting any pressure on your vocal cords. Here we go. Bella Mama, yeah. Bella Mama, yeah. Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, yeah. And it just goes round and round like that a few times. And now I'm going to pop the sound file on so you'll get to hear the other voices because it is around. So, but I'll be singing the first voice, so just sing along with me for that one. Here we go. 1, 2, 3, 4. Bella Mama, yeah. Bella Mama, yeah. Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, yeah. Bella Mama, yeah. Bella Mama, yeah. Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, yeah. Bella Mama, yeah. Bella Mama, yeah. Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, Bella Mama, yeah. Bella Mama, yeah. And that's it.
Thank you so much, Cleo. That was wonderful. I'm feeling much more relaxed. I hope that everyone else is. And it really helps to bring this research to life, to really engage with what the mothers and their babies experience. So thank you so much for that. I'm now really delighted that we're going to hand over to Professor Carmine Pariante. So Carmine is Professor of Biological Psychiatry at the Institute of Psychiatry, Psychology and Neuroscience at King's College London, and also consultant perinatal psychiatrist at the South London and Maudsley NHS Foundation Trust. And Carmine is one of the leads for the SHAPER study, and we're really delighted to have you here today. So over to you for your presentation.
Thank you, and I can't imagine an act more difficult to follow than Cleo. I've been at many scientific conferences where I have been, speaking after other colleagues, and I always felt I could kind of attract attention to what I'm saying, but not after Cleo. I think I'm lost. I'm lost for words, but I'll try to do my best to transform some of the energy that Cleo has created with her. Showing really the artistic energy of Melodies for Moms into the data that really can capture as objectively as possible the powerful effect of this intervention on mothers. So Lorna, if you don't mind sharing the slides, thank you. Okay, so here in this picture on the right, you can see Becky Bind, who has been the lead researcher for the project. She's currently on leave, so she wasn't able to join us. I'm presenting on her behalf for the work that she and an amazing team has done. Next one. And again, this is showing both the physical setting on the right, where the interventions takes place, but also on the left, what the Zoom call would look like when we done the PNDO online. So a shorter, much smaller study which we did during COVID, both for kind of maintain momentum in the research, since we couldn't deliver the proper intervention face-to-face, but also to try to help women who were, as you know, kind of closed in lockdown in their homes. The next one. Now, the SHAPER online has been fully published. This is the paper for those of you who are interested. It was a 6 weeks online clinical trial, so it was shorter than the 10 weeks classic intervention for the face-to-face. We didn't have a control group, so the interpretation of the findings are, of course, limited, but nevertheless, we could see in 37 women that were recruited because they had symptoms of postnatal depression measured with the scale EPDS, or Edinburgh Postnatal Depression Scales, that is a classic instrument to capture women with postnatal depression. And we also conducted further follow-up from the end of the intervention further. And as I said, the data have been published. I won't show a lot of details, but we did have a positive effect both on depression and anxiety. Next one. And this is the data dimensions. So you can see the Edinburgh Postnatal Depression Scales. The scores indicates the presence of depressive symptoms. A baseline, the values of the scores in these 37 women between 15 and 20, which indicates kind of mild to moderate depression. You can just see over the weeks, both week 3 and 6, these are 2 time points during the intervention, and then prolonged after that, there is an improvement of depressive symptoms. Thank you. Next one. And this is the data. This is now the main clinical trial. So the face-to-face one, the largest randomized controlled trial. As you can see, we moved from the 37 women in the study, in the online study, to almost 200 that were recruited in the face-to-face study. Same criteria, so the presence of postnatal depressive symptoms, APDS above or equal 10, so mild. At least mild, but we had many women with more moderate symptoms within the group. We randomized, which means we allocated women either to the single intervention or to a control group. There was a kind of supported attendance to local mother and baby groups organized by the local communities. And we did offer the single intervention also to the control group at a later stage, so that no women if you like, missed out on the opportunity. But of course, the women who received it, the women who were randomized to the control group received the intervention at the later stage, and those data are not included in the study. It's at 10 weeks, as I mentioned, so it's slightly longer than the online one, but 10 weeks is a standard duration of treatment. And we looked at not only maternal mental health, so depression, but also mother-infant relationship, biological markers of stress response, and we looked at quite prolonged follow-up up to 8 months period, so 6 months after the end of the intervention. We also looked at implementation and cost effectiveness, so measures that are more relevant to whether this is an approach that can be rolled out in the NHS. I mean, at the end of the day, the kind of the scalability that we wanted to test in SHAPER requires at some point a kind of approach of Melodies for Moms as an intervention, as a standard intervention offered as part of the NHS. And on the right, you can see the protocol of the paper. So the papers where we describe the study, you will see soon, hopefully, the actual data published. So what I'm presenting here has not yet been published, but is in preparation for publication. Next one. Okay, this is to show, first of all, 2 points I want to make on this slide. It's going to look a little bit dry with all these numbers, but I want to emphasize again that more women were actively randomized to the Melodies for Mom intervention, 133 versus the active control group, 66. So we actively randomized 2 to 1, so the more women were offered the intervention groups. But what I also want to emphasize is the point at the end, at the bottom of the slide, which is by the end of the study, we had 72% of women in the singing intervention that completed all of the 10 weeks of the singing intervention, but only around 52% that completed the control group, so which was the supported participation to local mother and baby community groups. So if immediately we could demonstrate that the mothers enjoyed and wanted to attend and remain committed and engaged with the Melodies for Moms much more than they were compared with other mother, infant, or mother and baby groups. Next one. And these are also the findings on the depressive symptoms. So remember, these are women that were recruited for postnatal depression. So our main outcome was the fact that we want them to improve in their depressive symptoms. And the slides, as you can see, has 2 lines. So the dark black indicates the group on the singing intervention. The lighter gray line represents the group in the control group. And you can also notice 2 things. So first of all, that the timeline goes all the way from what we call eligibility. So that's the first time that we measured the depressive symptoms in the mothers, all the way down to weeks 36. So that's 6 months after the end of the intervention. And the first 2 assessments, week 6 and week 10, are for the intervention period. Now, if you look at both the 2 scales, so both of the 2 groups, so both of the 2 lines, you can see that they all improve over time. But you can also see that as we move between week 10 to week 20 and then week 36, the difference between the group and the Melodies for Moms and the control groups become bigger and bigger. So you can notice how the improvement in depressive symptoms become more pronounced. And so the black line is lower than the gray line. So that means that the improvement in depressive symptoms, the drop in the depressive symptoms were more pronounced in the mothers that were receiving Melodies for Moms compared to the mothers in the control group. And we think that shows that Melodies for Moms is something special over and above just the fact that mothers were socializing together or living home and meeting other mothers with babies. There was something that had a special effect that specifically improved the depressive symptoms more than just kind of social activity. And we're going to be looking at some of the mechanisms in the next few slides. Next one. Okay, so first of all, we looked at what we call here mentalizing comments. It's a technical word, but what it really means is how the mother and baby interact together. Those were filmed, and we could rate the quality and the quantity of the speech of the mothers directed toward the baby. And as you can see, the black line again indicates the control, so the singing group, so the Melodies for Moms. From left to right is the baseline week 10, so beginning and the end of the treatment. And as you can see that the mother in the singing group, so the black line show an increase, the black line goes up from baseline to week 10, so show an increase in what we call mentalizing comments. These are comments that recognize the baby as a living-minded person to which the mothers could have a conversation, rather than, if you like, more of an object, or not quite a human, or not quite not a person to which the mothers could have an emotional connection. And so there was definitely an improvement of the ability of the mothers to talk to the baby throughout the treatment with Melodies for Moms, but the line in the control group is flat, as you can see. So there's really no effect of the control groups. And the next one. And here you can see even a more important one. So the negative comments, so the mothers expressing criticisms or negative observation directed toward the baby, actually decreased in the control, in the singing groups, the black line. You can see it goes down from baseline to week 10. So the mothers toward the end of the treatment of the Melodies for Mom actually said fewer negative things to the baby about the baby, while the mother in the control group show an increase, or tend to have more negative comments, perhaps just a consequence of the progressive accumulation of stress of looking after the baby, which was not compensated by the normal social interaction that they had in the control group. So again, a specific ability of the Melodies for Moms to improve the way the mother and the baby interact. And next one. This is showing more biological data. We looked at the cortisol, which can measure easily in the saliva, both of the mothers and the babies, and indicates the level of stress. And what I found really interesting is that, and this is in the group, in the Melodies for Moms group, you can see this is what you see in these slides is what we call the correlation between the level of cortisol in the mothers, which is on the vertical axis, and the level of the cortisol of the baby, which is on the horizontal axis. And when the line is flat, like you see on the left panel, it means there's really not a lot of correlation. But if the lines become more steep, as in on the right, then means that the cortisol of the mothers and the cortisol of the baby becomes more attuned, more synchronized. And that's exactly what we found. So by the end of the treatment, of the Melodies for Mom treatment, the mothers and the baby stress response biologically started to resonate, and the two values became closer and more connected mathematically, indicating that, again, as if you like, this could be considered the biological manifestation of the improved interaction, of the improved emotional interaction, which is shown in the slides before. Next one. Now, we wanted SHAPER to test the economic evaluation of this intervention, because the only way to bring it to the NHS is to show that it's at least cost effective, if not more cost effective than other potential intervention. And especially how much would it cost for local authority commissioners if they want to commission Melodies for Mom singing classes, and how does that compare to other psychological or pharmacological intervention? The next one. So I won't give you a lot of details, but I want you to focus, first of all, on the point 1 in these slides. So there was an improvement in the quality of life in these women, which was equivalent to gain around 15 days in full health over the 36 weeks of the study period. So over the 6 months of the study period, there were 50 more days in full health in the Melodies for Moms, which was not present in the group, in the control group. The other good news, and again, that's in the point 2, is that the cost of the Melodies for Mom intervention to NHS or local authority is quite more than reasonable. So the estimation goes from a lower cost of around 126 per mother and baby per program, so for the whole of 10 sessions. And the highest cost would be around £500 per mother and baby. And if you look at the next slides, you can see that this is right in the middle between, like within the range of interventions that are currently available, prescribed to in the NHS for mother with postnatal depression. So Melodies for Mom, Breathe Melody for Moms is kind of the third column from the left. But you can see, the second and the third column from the left. So you can see that they're very close to telephone-based peer support, and they're cheaper than listening home visits. So it's really kind of showing that they would qualify as cost-effective if evaluated by NICE according to the standard guidelines. Next one. And then this is the last slide before I ask Alex to continue. So this is the measure of what we call implementation effectiveness, is how much the mothers deemed the Melodies for Mom acceptable, appropriate, or feasible. Acceptable means that is, the mothers are, the treatment is agreeable, satisfactory to the mothers. Appropriateness is that it's fit for purpose, so it's exactly the right intervention, suitable for the management of postnatal depression. And feasible is whether it's doable and mother perceive it as something that can be easily implemented. And in the next slide, you can see, just looking at the number, and this is an intervention in the week 6, in the middle of the intervention, when mother had enough experience of the Melodies for Moms on the control group to be able to express an opinion. You can see that all the values for appropriateness and feasibility and acceptability. So all of the 3 lines, the values are higher for the Melodies for Moms than the control group, both numerically and with the p-value indicating a strong statistical difference. Again, showing that the mothers not only stayed longer and engaged more with the treatment comparing the Melodies for Moms compared to control, which I showed you at the beginning, but also those who stayed on both treatment, those who were in the Melodies for Moms judging a better treatment than the mothers in the control groups. And I think that was my last slide.
Thank you so much, Carmine. Some really powerful and exciting findings there. Well, now I'm going to hand over to our final speaker, Dr. Alexandra Burton. Alex is a senior lecturer in mental health research in the Wolfson Institute of Population Health at Queen Mary University of London, and also an honorary senior research fellow in the Social Biobehavioural Research Group at University College London. And Alex has been leading on the qualitative aspects of this study. Over to you, Alex.
Thanks, Katie, and thanks everybody. It's just really lovely to see all of this work coming together and complementing all the different stories and the data. So a lot of what I'm going to say is you'll have noticed this in what Cleo's just done and some of the things that Lorna's said. And the qualitative work really just helps to unpick why we found these positive results as well. So next slide, please, Lorna. So the aims of the qualitative research were to identify what it is about Melodies that seems to be having these impacts. Why was it perceived to be so acceptable, feasible, and appropriate? So what we did is we just asked the mothers, as well as professional stakeholders who took part in the project. So that included people that referred women in, so healthcare professionals, as well as people delivering Melodies for Mums as well. And so I think before I go on to sort of show the findings, it'd be helpful just to think about what we mean by active ingredients. So next slide, yeah. So normally and traditionally, active ingredients has its origins in more pharmacological research. So we usually use the term to describe elements of drugs, for example, that are responsible for the therapeutic actions that we see. So here we see there's a chemical component to a paracetamol, for example. So when someone takes paracetamol, that has a biological impact in the body. So it blocks pain impulses and inhibits production of inflammatory components, which then leads to the person taking the paracetamol experiencing the easing of their pain. So thinking about Melodies for Mums, this is just one example of many ingredients that we've kind of picked up after speaking to people. One of the key ingredients in Melodies is this shared lived experience among participants. So that shared experience is not only postnatal depression, often not talked about, but there's an understanding that women are there together experiencing the same challenges and difficulties, but this shared experience of motherhood, of challenges of motherhood as well. And what happens is when the mums are coming together in the singing groups, they're using singing to sort of talk about these experiences, but through the kind of songs that they're singing. And this really leads to a feeling of enhanced social solidarity and social support as well, which then leads us to the outcome of improved sense of well-being. So if you just can show the quote, Lorna. So this is a really nice example where a mum has talked about what that actually feels like when she's in the group. So she says, it feels like the start of one of those films where these unlikely characters get together and go on to form the commitments type vibe. You all have this shared uniqueness of being a mum. You have battle scars and all of these things in common, but you've come together in a way that you can't really describe to other people. So moving on to think about arts programs in general and the kind of ingredients that we see. So working actually with Katie, who's here with us today, on a paper where we developed the innate framework. So we know that arts programs are made up of lots of different components. And in this work, we identified 139 potential active ingredients. And we organised those ingredients into categories of contexts, people, and project. So context relates to the setting or the environment in which the arts activities are delivered, the places, the resources, and the surroundings that make up the activity. The people category is around the people that take part in the interventions or the activities. So do they have shared characteristics? Are they coming from different backgrounds? But also the people delivering the activities. So what are their skills, their knowledge, their experiences? Who are they? Who are they? And what are they bringing to the activity itself? And finally, we have the project activity components. So this is more around the attributes, the qualities, and the characteristics of the activity. So what is it about the content that could lead to improved health outcomes? So in terms of the results, we spoke to 22 programme participants, so mothers experiencing postnatal depression who'd taken part in Melodies for Mums, and 15 professional stakeholders, again, involving people who'd referred in as well as delivered the programme. And using framework analysis to identify some common themes, we found 3 core context ingredients, 7 people, and 6 project ingredients. So I'm just going to share what these are in the next few slides with some supporting quotes as well from some of the women and the professional stakeholders that we spoke to. So in terms of context, these were quite practical ingredients. So most mothers found the location and the ability to get to Melodies fairly easy. It was in their local areas. It was in children's centres, so these were familiar places. There were some challenges around getting there, especially for mothers who maybe were a little bit nervous about getting on public transport. And similarly, the time and day of the sessions could be a problem because babies' routines might get in the way of the sessions. But most of the mothers found solutions, and most people recognised that everyone would have these different routines and preferences. In terms of the marketing and the recruitment and advertising, most participants found it really appealing and attractive and encouraging as well. So the quote in the bottom left-hand corner, a mum says that she found it really reassuring to read on the sign-up that nobody would be forced to sing by themselves. So if she hadn't have seen that kind of positive message, she might not have taken part. And she says that was really clever and sort of hooked her in. The other element to the recruitment and advertising was this positive feedback to the referrers, so that they had in mind if a participant had really positive experiences, had done well from the programme, it would then be something that they would continue to refer other patients into through NHS pathways. Next slide, please. In terms of the people, as I've mentioned, the shared lived experience of the participants was really key, but also the support from additional staff. So there's a singing lead and also always a support member of staff within the groups who helps with just making sure everyone's happy, everyone's got drinks, everyone knows where the toilets are, but also just sort of on hand if there are any issues. So this is a really nice quote showing just how relaxed that made women feel when they entered the environment. And I think the really key thing about this quote is how for this lady it made such a huge difference because it made her feel like she could ask for help, and that's just not something she was able to do before she took part in Melodies. Again, skills and values of the music leads were really key. So here we've got a really nice example of just a singing lead challenging somebody's sort of negative experiences of singing and trying to increase the confidence of participants, both directly but also by sort of giving their own experiences of vulnerability. And I think the thing that really perhaps explains this shared cortisol association, as well as the kind of communication as well, is the fact that, yes, the mother is the center of this activity, but the way that singing helps mothers interact with their babies is really key. So here we've got a really lovely quote about a mother before she took part in Melodies, not being able to make eye contact with her baby, and afterwards when she sang, the baby would look at her, and that really helped with bonding between mother and baby. Next slide, please. And then the final ingredients were about the program itself and the content. So again, just basic kind of structural stuff around weekly sessions, 10 one-hour sessions that really help mums have a sense of routine and getting out the house, and also just the same times, the same women all coming together. Having a flexible and adaptable structure was really important. So this again is a quote from a stakeholder who observes a session being done and seeing the singing lead read the room and realise this energetic plan that they'd had wasn't going to work because these mums were exhausted. So instead the singing lead just sang to the mothers and relaxed them and calmed them down. The difficulty level was often perfect for mothers, so it was balanced between it being easy enough to do when you're sleep deprived and you've got your baby, but also difficult enough that it took them out of themselves a little bit. And that's really important when we think about depression and just having that distraction and having that sort of focused time to do something and think about something else. The diversity of songs was also really key. As Lorna said at the beginning, it was a nursery rhyme-free zone. But the diversity really helped mothers produce different tools for engaging with their babies. So having calm songs when babies needed to sleep, to help them to sleep, having more playful songs to help interact with their babies. But also on a personal level, a lot of the songs have very emotional or kind of themes around motherhood that really sort of tapped into how mums were feeling. And while they were uplifting, they were also really sort of beautiful and emotional. And I think the really important one here is just, there's just something about singing together as a group and this communal act of singing. So mums talked about relaxation and calm, but again, having that space to sort of think about something else and to focus on something and creating something together. So finally, just to conclude, I think we can see that Melodies is considered to be, sorry, next slide, Lorna. Melodies is considered acceptable, feasible and appropriate for new mothers experiencing postnatal depression. The people and project ingredients were key for implementation success. The contextual ingredients are a bit more peripheral and it's mainly barriers in that area that existed for some mothers. So it could be that different venues, for example, could be flexible in terms of that not reducing the impact of the singing. And the findings can really help inform the design and adaptation of future creative mental health programs. Thank you.
Thank you so much, Alex, and thank you so much to all of our speakers today and singers. That's been such important and in-depth research that we've all heard today, and I'm sure that it has inspired all of us. Thank you so much. So we've got about 10 minutes for any questions that anyone may have. You're welcome to raise your hand or type them in the chat. So does anyone have any questions for our panel today? Whilst you're all having a think, I'll kick us off to ask a question to get the ball rolling. So I think this is probably a question for Lorna and potentially Cleo as well, if she's still here. I was wondering whether you could give any advice for anyone wishing to kind of set up a group like this or go along to a group like this, because I'm conscious that some people on the call here might be thinking, oh, I'd really love to do something like this. Like, how can people get involved, basically?
Well, I think what I would say is that these, not to sound too negative, but I think something that really has helped Breathe Melodies for Mums is that as an organisation at Breathe, we don't just kind of set up a program then disappear. We really are all about delivering sustainable programs that have a long-lasting kind of impact and presence, and also that they're based on really rigorous evidence. So I think in that sense, I think what really helps to kind of run or set up a group like this is really making sure you've got kind of sustainability in mind. But I mean, I think in terms of engaging with a group like this, I think something we've really tried to do to engage participants in our groups is to really break down the barriers that they're facing already to accessing support. So it's things like, we don't talk about we don't use the term postnatal depression in our literature. We actually talk about the symptoms because that's more relatable for people who might not even realize they're experiencing postnatal depression. So I think also, as Alex said, one of the things that's really important about this group, again, that makes it accessible, I think, is having it's not just a singing lead running this group. They're supported by a huge wraparound support around the women to even get to the sessions in the first place. So I think that is another thing that we've kind of really tried to break down as a barrier, is actually the singing takes place for an hour. And obviously that's a really critical part of this program, but there's so much that goes on around it to kind of support people into and out of the session. So whether that's kind of supporting with travel or supporting with access or supporting with signposting to other services that they might need. So I don't know if that answers your question, Katie, but hopefully it kind of explains how we've broken down some of the barriers to
Absolutely. Yeah, I think that sustainability and access is so important. Jaya in the chat has actually sort of a bit of a follow-up question, which might link in with what you're saying as well, is whether there's an opportunity for people to do a course to do these Melodies for Mums sessions. I know you run training, Lorna, so is there anything you wanted to say on that?
We do run training at the moment for international teams, because we kind of recognise that as a UK-based organisation, it's very difficult for us to go and kind of deliver these programs in a completely different cultural context. And that was the basis of the whole WHO Music and Motherhood project, was to understand how arts and health interventions can be delivered in different cultural contexts. In regards to kind of how we scale it and work nationally, I think, what we have been focused on at Breathe is kind of really embedding and building our delivery around London, where we're based as an organisation. And I think what we're looking at now is how we can kind of partner with local organisations to deliver this programme in more locations. But certainly training has been, suggested to us previously. So thank you for that. And we'll have to keep you all updated as to how our kind of national scaling goes.
Thanks very much, Lorna. And just on that project that Lorna mentioned about the international project, we actually did create a resource, which was like a guidance tool, which I can paste in the chat, which might also have some tips for you if you're thinking of doing something like this. But for now, we'll go over to Miriam for your question.
I think my question was kind of answered. It's just like, this sounds really great. Being up in Scotland, obviously our families are quite far away, and we have the wraparound care. We do the support, the early years, and we do the relational stuff. It's just this aspect of singing. So I think I love the idea of it, but it seems like there's a lot of scientific evidence as to what the singing would entail, how the melody would affect them neurologically. So therefore having training on that singing aspect, as was asked before, would be really good. And it would be something that, as a service who are already delivering that support, it would be like an add-on aspect of it. So I feel like my question was kind of answered, but I didn't lower my hand fast enough, to be honest.
That's great. And it's also good to hear that we're addressing questions that are relevant to others in the group as well. So we've got another question in the chat from Jane. The identification of music leaders is clearly key to the success of the programme. How do you select music leaders, and to what extent are they involved in the evaluation of impact and outcomes?
So I might ask Alex to talk about how we involved music leads in the qualitative aspects of this research. But in terms of the music leads we work with at Breathe, we have worked with many of them for a number of years. They've been experienced in kind of leading groups, working in creative health settings, and they actually have a really diverse range of kind of expertise and experience. I think it's a lot about being able to kind of lead and work with groups, like more targeted groups, and we also provide training for our music leads as well. What they don't have to be music therapists. I think that sometimes comes up, that question. Occasionally some of them are music therapists as well as music leads, but it's not something we kind of require. Actually, it's about that kind of diversity of experience and expertise, and how and also, again, the training and support we provide them. So sorry, that's not an exact question. I wouldn't say we have an exact job description, but I think we work with, I think, something like over 50 freelancers at Breathe across all of our projects. So we really do have quite a range of artists that work with us, and they don't just work with us, they work on other projects too.
Thanks, Lorna. Alex, did you have anything to add around the evaluation?
Yeah, I guess it's just to re-emphasize the sort of methods of the qualitative work was inclusive of people delivering melodies for mums, and the kind of questions we asked them was not just about the impact on the mothers themselves, but also the sort of things that they need to be able to deliver this effectively and what support is useful for them. So that's also been fed back to Breathe as well.
Thanks, Alex. And we've also got our question from Una. How did health visitors respond to the project?
Really, really well is what I would say. And they are a massive source of referrals for us. So just to give you an example of like a recent project in the community outside of research, we actually had 21 different referral routes for women coming into the project. And so we've built this huge network of kind of health professionals, including health visitors, who will meet women in the community and say, oh, do you know what, I think you could really benefit from participating in this. And so they're a really important route of referral for us. I actually just wanted to say as well, just before I forget, that actually we are running an online program this summer, in the summer term, which is open to mothers across the UK, actually. So if there are people that you know that might benefit from participating, that's free to access. And I can pop the link in the chat if anyone wants to kind of share that with your networks.
Thanks, Lorna. That's really great to hear that you'll be able to have that broader reach through the online programme. We've also got a question from Jenny. Were all the mums living in the community, and could this be embedded on mother and baby units?
Yes, so yes, for the SHAPER study, I think, and Carmine and Alex, you might want to remind me, because I think they were all South East London based. I don't think it was strictly Southwark or Lambeth. I think the groups took place in Southwark, Lambeth, and one in Lewisham. But actually, I think we opened it to people across London to participate, if I remember.
Yes, it was mostly based around geographical proximity to the area where we were going to deliver the intervention. I mean, by chance, most of the women would have been under the care. Those who were under NHS care for perinatal mental health would be within the South London Mods NHS Trust, obviously, because it overlaps with the recruitment zones, but only a minority of women were outpatient or seen at the same time at the Maudsley perinatal services. And there were no women that were inpatient. Although, Lorna, maybe you want to mention your experience with delivering Melodies for mums in the mother and baby unit.
Yes, so I touched upon it briefly, but we did actually work with researchers in Carmine's team again to conduct a service evaluation of how we implemented Breathe Melodies for mums on mother and baby units. So we have worked in 2 mother and baby units in London. Obviously, the delivery really is different, because what you're reaching every week is a different cohort of people depending on who's been kind of admitted and discharged on the unit. So it's a very different approach compared to kind of building across 10 weeks of, you know, the kind of singing with the same group. But we found in the evaluation that it was really effective at reaching mothers who are experiencing postpartum psychosis and maybe typically hadn't been able to engage with other kind of groups on the ward. So that is actually something we'd like to look at a bit further. It also boosted the kind of atmosphere and the environment of the ward. It lended itself to a kind of more positive kind of experience, mood on the ward, which was the feedback we had from kind of staff and professionals on the ward. And it was also successful at kind of engaging people in groups more broadly. So yeah, lots of exciting things that we found in that evaluation, and we want to build on it. But yeah, certainly it definitely has shown that we can deliver it in that setting. And just those that maybe don't know about mother and baby units, it's a unit for new mothers who are experiencing more acute symptoms of kind of mental ill health and need to go. It's a place they can go and stay with their babies to recover and receive treatment at the same time.
Thank you so much, Lorna. I'm just conscious of the time, so we are going to have to move towards wrapping up now. I hope you all join me in thanking our lovely speakers. If you do have other questions, please send an email, and I'm going to hand over to my colleague Nancy to just tell you a bit more about ACHWS before we close today's session. But thank you so much to you all for joining and to all our wonderful speakers.
So yeah, I just wanted to quickly mention that Arts, Culture, Health and Wellbeing Scotland arrange a whole series of online conversations about a lot of different topics. If you want to either go onto the website and sign up for the newsletter if you're not already on it, or you have ideas for things you would want to be hearing about, or even setting up a panel discussion in Scotland around the practice that you have, then get in touch with me at info@achws.com. No, it's not .org. I just suddenly had a brain fart. So info@achws.org. And the other thing is just to let you know, it has been recorded, so everybody that signed up for this session will get an email with the recording link on it. It's going to go up onto the our YouTube channel, but I will actually send it out to the list of people who've joined the call today. So thank you very much.
Thank you, everyone.
Thank you.
Thank you very much. That's amazing. Bye.